Welcome once again for the Ask Me Anything on Diabetes with me, Dr. Aniket Banvi. Well, I'm glad that you all are watching it. The previous one was really appreciated by many people, and I'm glad that you got along with that and it helped you in a better way. Well, today, once again, we are here to address various other questions on diabetes asked by many of the patients, and I'll be taking them one by one now. Now, without any delay, let me first go to the person who has asked us about, is it possible to reverse diabetes, which one has for 15 years? And this was asked by Maharaj. Great to know that they are looking forward to eradicate this disease or disorder from their life. And unfortunate part is that they are suffering from this from more than 15 years. Now, there are many reasons for that. There are multifactorial things. Now, we need to understand, sit with a person to understand what is his case and what is he going through, what are the lacunas, where are the loopholes, and what is to be executed, what is to be done. Now, that is when we can say this is a thorough study. That is when we'll be able to say, is it possible or no? It is definitely possible for a type 2 diabetic person. The reason is because the person is able to implement certain things in his life, and that is the way we have found out that it can be managed. Recently, a patient of mine in November 23 November consulted me, and his postprandial blood sugar levels were somewhere between 300. And after 2 weeks of me consulting and sitting down and breaking down and helping him understand what are the loopholes and where we should be correcting, and the moment when he implemented them, after 2 weeks, his blood sugar levels, postprandial blood sugar level, came up to be 133. Now, the difference is because when you correct the right root cause, you will be able to see the difference. And there are many other complications also we are seeing in today's time and scenario. So we need to sit and define. I cannot just read this question and say whether a person who is suffering from 15 years can reverse it or no. I need to study whether you're a type 1, type 2, what are the medical history that you have gone through. So it is not an easy answer, and I will not give you or false hope saying that it is possible. It is possible, yes and no. There are two sides to the coin, and you need to understand that. So there is no fixed one answer for that. But what I'm saying is that we need to discuss. You need to get in touch with us. You need to get consultation with us, so that you will have I will have an understanding whether to tell you that, see, this the case scenario what we are seeing in your case, this can be done. This is where you are, and this is what we can do, and we can eradicate this problem and disease that you're suffering from. So that can be done, but we need to study. So there is no one answer solution I'll be giving you right now, because this is a very generic platform, and I cannot simply blabber around anything that comes to my mind. I need to be very appropriate and help you in the right direction. So you need to get consulted before you decide whether a 15 years of you being diabetes can be reversed or not. And that needs a thorough understanding by a doctor, by a physician. And that is the answer that I'll be leaving you with. Great. So that was a great question. Let us come to the second question that we have. That is, please give examples of micronutrients. And this is asked by Chetana. It's a very great question and a very essential question for diabetics. Now, let me tell you why. Uh, Micronutrients, and there is something called as macronutrients. You need to understand there are two things, macro and micro. Macro includes your carbohydrates, your protein, your fat. All these things, all the macro will definitely provide you some amount of micronutrients as well. Now, let me tell you what are micronutrients. Micronutrients are nothing else but vitamins and minerals. In today's time and scenario, people are not consuming enough amount of good source of food or healthy foods, and they are lacking in these nutrients. that which is vitamins and minerals. And majorly, if you want to understand a broad example of what are these micronutrients that we are speaking about: vitamin A, B1, B2, B3, B5, B6, uh, B7, B6, B7, and B9 and B12, and vitamin C, vitamin K, vitamin D, vitamin E are all vitamins that we see, major vitamins that we see majorly broadly. And then there are minerals, which is zinc, chromium, magnesium, all these set of many more. There is again zinc and many more other list of nutrients that are required for your body. And for a diabetic, all these micro and macronutrients, and especially the micronutrients, are very essential. And if you see, in today's time and scenario, there are about 70, more than 70 percentage of the population is vitamin D deficient. And if a person is taking metformin, it is said to be that to a certain extent a person will be bound to have a vitamin B12 deficiency. So these are majorly seen if you are a diabetic and craving for some kind of a sweet after each meal. Then you need to check your zinc, magnesium, chromium levels, because these micronutrients are deficient, may be deficient, maybe may not be. And that is the reason why a diabetic craves more amount of sugars, or he enjoys eating the sweet once he finishes meal, or he wants to end his meal with some kind of a sweet. And that is, these are the very important micronutrients that are essential for human, and all the other nutrients as well. So make sure that you take these right set of macro nutrients so that you meet the right set of micronutrients also. So macro and micro should be taken care. You will get your micros from the macros itself, which is the combination of carbohydrates, not the refined carbohydrates, not the simple carbohydrates, complex carbohydrates, a good source of proteins and fats also. You will get your micros and macros. So I hope I've answered the second question appropriately, and it has satisfied you, I believe. Great. Let me move further and address the third question that has been asked by, there is no name, anonymous person. What are the primary risk factors for developing diabetes? Now, if a person is uh, not having a good food habits, is definitely a big risk factor, because what you eat is directly reflecting on your blood sugar levels. If you're obese or overweight at this point of time, then it is also a risk factor that can lead you to be a diabetic or a pre-diabetic in the near future. If you're physically inactive, that is also a concern that will also lead to a person being in the risk of being diabetic or even a pre-diabetic also. So food habits majorly, then not having the right set of food habits, that is one thing. Physical activity is another thing. All these things will lead you to be a diabetic. So these are the major risk factors. Consumption or abusing some kind of an addiction in your life, that might be alcohol, tobacco, smoking, anything, that will definitely lead to the complications and risks for being a diabetic. And how can one individual assess their own risk? So how can you assess? It is through your signs and symptoms. It is through the way your body is communicating with you. When a person is diabetic, or when a person is a pre-diabetic, he starts seeing certain symptoms in his body. He'll see lack of energy and enthusiasm in doing any kind of activity in his life. He will start seeing frequent urination, thirst, and all those other complications. He'll feel, very much hungry. The hunger, appetite, and all goes up increasingly high. All these things are the indications saying that there is something wrong in your body and you need to correct yourself. So all these things are something that you need to note and self analyze, that whether your body is responding correctly or not. And this is how you can assess whether you are at the risk of being a diabetic or not initially, through understanding the way your body communicates with you. So that is one part of it. Let me move to the another questions that we have. How does diabetes impact the body's ability to regulate blood sugar level, and what are the long term consequences of uncontrolled diabetes? So majorly for a type 2 diabetic person, it is said to be the insulin being resistant. Not insulin being resistant, but the body cells being resistant to the insulin. Your body is able to produce enough amount of insulin, but the cells are not utilizing it in an appropriate way and taking the glucose inside your blood inside your cell, and it is stagnant in the blood sugar. So that is causing a lot of complication. Now if this persists for more than 15 years, as previously I got a question asking that the person is diabetic for 15 years, and let us imagine that the person has been diabetic for all these years, and what are the long term consequences that he or she will face. The complications that he or she will face is, majorly the arteries and blood vessels are being damaged. You will see diabetic retinopathy, that is damaging of your eye, which will lead to many more complications. You will see that is damaging of your nervous system, where you will start feeling tingling and numbness sensation in your hands and feet, all those complications. Then you will see, furthermore, gangrene to amputation, wound healing process will be decreased, and healing process will be reduced, and you will see furthermore complications. So it is very increasingly seen, and these are the major long term, indications. Even till the heart strokes and blockages in the heart are related to diabetes, because poor management of diabetes leads to so many complications. So make sure that you are aware of those things and you take the responsibility of taking care of your health now itself. If you're a diabetic and so take the charge, take care of your health, and avoid these long term complications that I am talking about. Because I've seen patients, when I have worked as a doctor across hospitals, and it is very painful to see them. The wounds are open, the heel is having a complete big hole. Certain people are not able to heal it. The You can see the inside. It is very painful. I've seen very bad such case scenarios, and it is very disheartening to say that I've come across, and people are not able to cure themselves, and they are ending up, to amputation and many other things. So make sure that you don't go to those risk factors, don't go to that complications, that consequences will be very much painful in the near future. That's the answer for that. What is the next question? What role does genetic play in developing diabetes, and how can an individual with a family history take proactive measures to prevent or manage the condition? Now, genetic plays in both the formats, type 1 as well as type 2. When it is type 1, unfortunately, what is the major scene is that we see that your own body cells, your own immune system is attacking your own body cell, that is your pancreas, and damaging the production of insulin. And eventually, over a period of time, you will be not able to produce any amount of insulin from your pancreas, and that is an autoimmune disease. It is also said to be, to a certain extent, as an idiopathic, where we don't know what is the actual reason person is suffering from. The actual reason why the person is suffering from type 1 is very much unknown. It is also said to be as idiopathic, but your majorly we understand that your own body cells are attacking your own body cells, saying that this is something which is not good, or it is harmful, and it will end up, the process of producing insulin, and you will end up not producing insulin. And that is why, if you see, the type 1 diabetics are called as the insulin dependent diabetics, where they are supposed to take the external insulin and manage their diabetes. Whereas when it comes to type 2 diabetes, Genetic factors plays to a certain extent, but it is also in the patient's hand to take care of their health so that they don't end up being a diabetic. It also puts them in a very much edge where they can be easily obese, easily put on weight. The insulin resistance is very much prevalent, and many other complications in the near future scenarios if you are type 2 diabetics. And this is what a genetics plays a role in type 2 diabetes. But you can manage it if you start taking care of your health initially. If you are taking care of what you eat and what kind of a health are you maintaining, what kind of a physical activity are you doing, how you live is very much important, how you live daily, how are your habits is something very important to address and study, so that you will be able to do them in the right format and manage this in the long term. So you can manage the role of genetics when it is in diabetes in these formats. Whereas in type 1, as I said, it is very much impossible. You have to externally inject insulin in your body as of now. And whereas in type 2, it is definitely in your hand. You need to take charge of your health by correcting your various, the way you live and the habits that you have. And that is how you can avoid being a diabetic. If your father or mother are already diabetic, and you think that genetically you might also end up being a diabetic, then you need to do these things. Great. Let us move on to the further question. How do how do different type of diabetes such as type 1 and type 2 differ in terms of their cause, symptoms, and treatment approach? Great. Now, symptomatically, uh, if we are not checking the reports but just talking in terms of the cause is different. Type 1 is caused because of the autoimmune disease where your immune system attacks your body cell, whereas in type 2 is because of your lifestyle, lack of physical activity, bad food habits, and insulin resistance. All these things is type 2 diabetes. Now, how these two are very much different, this is how they are different. What are the different symptoms that we see? There are very much same similar differences that we see in type 1 and type 2 diabetes, but we'll be only able to understand in detail whether it is a type 1 or type 2 by checking other sets of medical parameters to study whether your body is producing enough amount of insulin or no. If you are a type 2 diabetic, in most case scenario your body is producing insulin but it is not being utilized by the cell. That is the case in scenario. Whereas when we check for an type 1 diabetic, we see majorly that the insulin production is slowly decreasing, and the insulin eventually stops producing by his pancreas. And that is when that's a major difference that we see for in a type 1 and type 2 diabetics. And the treatment approach is also very much different. A person with type 1 diabetes will be given external insulin to manage his diabetes, whereas in type 2 can take, there are oral supplementation, oral drugs, which is given along with their lifestyle modifications, food habits, stress management, and physical activity can be managed in the long term. So this is how type 1 and type 2 differs, and this is how type 1 and type 2 can be managed. Great. What is the next one? Are there scientific lifestyle modifications such as excuse me, diet and exercise that have been proven to be effective in preventing or managing diabetes? What are some practical tips to incorporate these changes in day to day life? Now, when I say right now, vaguely, we say you to exercise, have a clean diet, have a good amount of combination of carbohydrates, fats, and protein, and get your macros and micros in place so that you have a good amount of healthy regulating body. Along with that, manage your stress and all those things. Let me detailedly tell you certain tips that definitely you should definitely a diabetic should follow. Now, many diabetics, when we discuss, when I have been consultating people, they say, I ask them, explain me your routine elaborately from the time you have gotten up. And one thing most Indians definitely say to me is that they say that as soon as I get up, I make a cup of coffee for myself, sir. I make a cup of tea for myself. I add 2 spoons of sugar, and this is how my day starts. And most of the times when I'm asking them to correct their lifestyle, the first thing that I ask them to do is that keep aside the milk and milk products. If you want to drink tea or coffee, I would ask them to avoid drinking majorly coffee. If it's a black coffee, no issue. If it's a green tea, then no issue. Don't add milk and sugar. If you want to drink your tea, if you want to drink your coffee, drink it like that. Drink it without the milk and the sugar. Then you taste that is the real tea and that is the real coffee. And the reason I'm asking is because I would ask you to avoid even coffee, is because coffee is a stimulant. It increases cortisol in your body. Cortisol is directly helping a person to increase his blood sugar level, and that is the major complication. And many times if you ask a person, why does his fasting blood sugar level and all those complications, or early morning my blood sugar level is very high after consuming coffee, when I checked after 2 hours also it is extremely high. People have seen changes when they stop drinking coffee early in the morning. You can, if you want to drink a black coffee, somewhere between 2 to somewhere between 10 a.m. to 2 p.m. is fine, but don't drink after 2 p.m. Reason is because it disrupts your sleep cycle. That is one thing. The if you're looking forward to consume tea, please do switch for green tea or herbal tea. That is much more better. The reason I'm telling why is because this green tea or herbal tea is basically made out of plants majorly. And what is it going to give you? It is rich in antioxidants, it is rich in anti-inflammatory, filled with polyphenol, and has a great amount of energy to provide, nourish your gut health majorly, and helps in regulation of your blood sugar level, also your fasting blood sugar levels. So having a green tea, having a herbal tea is absolutely good for your health early in the morning. If you want to break your fast, that is, you have fasted for 8 hours or something, and if you want to break it by drinking a green or herbal tea. That is one thing. That is the first tip that I would suggest you to do. The second one is that you need to do physical activity. Apart from that, there's something that you have to do definitely before your meal. Before your each meal, make sure that you eat a set of salads, a plate of salad at least, which includes cucumber, onion, carrot, any salads that you enjoy, the vegetable or fruit that you enjoy. Chew them properly, consume them before you begin to eat your chapati, rice, sabji, and all those things. Eat a plate of salad. The reason is because these are the prebiotic in nature. They activate the good gut bacteria. Apart from that, they helps in production of incretin, that helps in production of insulin and helps in regulation of that. It also helps you to reduce the spike in the blood sugar level. That is the number two thing that you need to do. Eat salads before your meal. The number third one is that make sure that after your each meal, go walk for 15 to 20 minutes. And this has been shown to be very effective in managing diabetes, especially the postprandial blood sugar level. When you walk for 15 to 20 minutes after your meal, it has been shown that postprandial blood sugar level can be managed very effectively. So these three things: break your fast with a herbal tea or nuts and seeds. Before your meal, make sure that you eat a plate of salad. And the last one is, make sure that you walk for 15 to 20 minutes after your each meal, and that is going to bring a lot of change. Now with that, we have finished all the all the questions that have been asked by various people. And there's something that interesting. If you want to know much more in detailly, what we do is that we conduct a webinar called as knock diabetes, where we elaborately discuss on these things which I have discussed on, managing and conquering diabetes with the confidence that we are speaking and we are hearing right now. Diabetes needs education, and more than even medication, we believe. That is why we are here and trying to educate. And if you want to learn much more in depth about diabetes, you can join the webinar. The link is here in the video above or below somewhere. You can click the link and register for the upcoming webinar. And also, if you have heard my previous video, you must be knowing already that we are on a mission to help more than 1 million diabetics, because as it is said to be that India is the capital of diabetes, which is a very disheartening to hear, because it's a major health crisis in today's time and scenario. And that is why we want to bring knock diabetes webinar to all of you, so that we can equip you with the right set of tool to conquer this, or even manage it very effectively by the natural ways that are available in your home, at your hands, at your own vicinity. And the session will be absolutely live. With that, I'll take a leave. Take care of your health and have a good weekend or weeks coming ahead. Take care. See you on the next Wednesday.